Perfect, 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 perfect. Okay, well, let's get started. Welcome, everyone. Thank you so much for joining us today. And I recognize that there might be a few additional people over the next few minutes as they walk in, but I hope that people will appreciate that those of us who are on time should get started. So welcome to this town hall, e-hall as I like to call it, meeting. I apologize for the short notice for this meeting, but it was really important to continue our conversation around reopening of research at our school. And so this is part of the same series of conversations and discussions around research reopening at the School of Public Health. Let me first begin by a positive thought. I hope that you are safe. I hope you're healthy. I hope you're both physically and mentally well. Sending you positive thoughts wherever you are, at home, at work, or at another third location. Just hoping for everyone's safety and health during these times. But with that positive thought, I'd like to recognize that members of my office are online as well. We will be monitoring the forum. Some of us will be monitoring the chat board. Please use the chat board function to put any questions, comments, reflections, anything that you'd like to share or ask, and we will be sure to try and cover those within this session. But if for some reason we are not able to get to it, definitely electronically, we want to follow that up with you. I also want to welcome our Executive Associate Dean for Operations and Chief Operating Officer, Natasha Kazim. Thank you very much for joining us, Natasha. And I may pull you in responding to questions and queries depending on the nature of the work. Really appreciate you joining and members of your team joining us to help respond to any queries. I also want to recognize all the faculty and staff who are sparing this hour to be with us. I want to make sure this is productive. If we don't need to spend the whole hour, we can end early and go on and go back to our various work. But if we do need to, then certainly want to be available. I also want to thank members of the faculty who are in the research committee, chaired by Professor Irene Ko. I think the research committee has really stepped up to the plate and really been a very, very strong partner in this whole process. Many thanks to all of you who serve on it, and to Irene, of course, for providing leadership. The plan for today is that I'd like to open the meeting up with a brief review of what I feel might be interpreted to be like a summary of where we are. I will make sure that before the end of the day, materials are accessible to everyone, and that will give the opportunity for people to both look at them, read them, see how they relate to their own situations, but also reflect on them and provide comments and considerations. So I want all of you to be aware that what I'm about to do really is provide a very big overview of the process. As many of you know, GW, of course, has to follow District of Columbia rules and regulations in terms of reopening, and the university has established a process whereby, and a report that is, I believe, with the District of Columbia. Some of you have been leaders in that process. Thank you very much for your contributions. So whatever we talk about today is very much under the framework of the GW-wide plans. And in particular, the Office of the Vice President of Research, whose function really is to coordinate research across the whole university. So at any point in time, if you find that there is any inconsistency between what we might be discussing at the school and at the university, please alert us, especially please alert me, and I'll ensure that we rectify that and move the things forward. So I'd like to indulge you for the next 10 minutes in giving you an overview of what's been happening. And I hope that this is useful. I want to give you a brief introduction to two parts. One is our own efforts, where many of you have participated thus far, and some of you are going to participate henceforth in our reopening guidelines. And then also, I want to spend 2 or 3 minutes in reminding you about the Office of Human Subjects Research and a few guidelines that they've issued last week that I want to make sure that everybody is familiar with. So on the 8th of June, the Office of the Vice President of Research released a 3-page memo that basically indicated that we should start thinking about reopening, and that provided a framework, not details, but a framework for each school to start working on it. And after discussions with the dean and the executive committee, we went to our research committee, and I want to thank them for working very closely with us. And basically, they indicated that we should put together faculty working groups. And so I'm going to describe to you these working groups and what they've done. We've actually put the work of all of the working groups together into a single collated document, which will be available by the end of today on the Office of Research Excellence website. And this document, this collated document, has 5 sections. And I want to tell you what they are. I'm not going to go into tremendous detail right now, but simply give you the lay of the land. The first section, which is very brief, really introduces everyone to the reopening guidelines and fundamentally to what we are calling the 4 principles, right? That the health and safety of our community is paramount, that we want to be evidence-based in the production and implementation of these guidelines, but we also have to be flexible because things are changing every day. And as you all know better than most people being in public health, how the COVID-19 pandemic is forcing us to affect our decision-making on a regular basis. And of course, that we want this process to be inclusive for faculty, staff, and our student populations and our communities. And this e-hall is part of that process. So section 1 of the report is a brief introduction and reminds us of the perspective of that particular document. Section 2 is really a cut and paste job from the guidelines that were released by the Office of the Vice President for Research. OVPR's guidelines are available on their website. We've actually cut and pasted the entire 3 pages into this document so that those of you who may have missed it, those individuals who may not have seen it, can read it for themselves. And fundamentally, OVPR also enunciated 4 guiding principles, ensuring that safety is our top priority for the GW community, that the university will follow directives of the District of Columbia and other governments that pertain, especially those like Maryland and Virginia that are adjacent and where many of us actually live, that they will also follow guidance from the university-wide task forces, and many of you serve on them, and they also indicated that it would be a process which would be phased and of course transparent, and there have been at least a couple of opportunities for researchers around the university to participate in meetings with OVPR staff, including Dr. Bob Miller. So our guidelines are very much under the framework of this 3-page guideline from OVPR, and section 2 will identify that. In particular, I want to remind you that the Vice President for Research indicated phased reopening, and currently we are in phase 1 since June the 8th, where we have limited reopening. There are plans to get into more phases where there will be an expanded reopening, but for now, that's what we are operating under. And of course, you're welcome to read more about this in the OVPR guidelines. Now, the next section in our document, again, is very brief. It basically refers to the fact that the School of Public Health is developing a general reopening plan. And this general reopening plan, which is largely concerned with the operations of our facilities, of our buildings, of our day-to-day operations, is under the remit of Dean Kazim. She is here, of course, and is, I'm sure she and her entire operations team, which is inclusive of facilities and all of that stuff, and can answer relevant questions from there. But fundamentally, how do we return to our buildings? How do we use them? What sort of signage will there be? What sort of general rules and regulations for the use of protective devices and masks? What types of best practices can we have in terms of transportation? And any other materials related to the general reopening of our school will be covered by those guidelines. So our guideline that I'm going to talk about today is specific to research. For general guidelines, we have referred to the school ones that are also under development, and maybe later on I'll request Natasha to provide a minute of update on the status of those guidelines. The meat of our document really is in section 4. And section 4 is where we have taken the work of 5 working groups where faculty and staff participated, And I want to thank in particular, not only those who participated in them, but also the leads of these, because they worked very hard in drafting and responding to comments and reflections thus far. And so we had 5 working groups. The first one that I've put here is community-based research that was led by Irene and Dave. And in their draft guideline, they've talked about some general principles about how through a phased approach, community-based research can start, what are some good practices from limited reopening all the way through resuming total research operations, and including some thoughts on looking at in-person contacts for research subjects and indeed procedures if that happens. Again, some of this may be picked up in the general guidelines, but for now, we want each section to be reasonably comprehensive as well. Our second working group was on clinical research, and Melissa McCarthy led that. And in that draft, we are talking about clinical research, which is some general principles, irrespective of where it's done, if it's done in the School of Public Health, or at least in a School of Public Health run clinic, and of course, some general ideas about if it is done in healthcare settings, such as our hospital and also the MFA. So these details are provided in this draft. The third working group was on global or international research led by Emily Smith. Here again, it is very important for me to point out that this is inclusive of not only general guidelines, but obviously is going to be affected by our travel policies. Our travel policies across GW were issued earlier. For those of you who may not be familiar, we're happy to send you links to that. But essentially all travel is discouraged, and travel exceptions have to be approved by the Dean's office. And they have to be obviously quite essential, particularly mission critical in the case of research, especially for faculty, and student travel is highly, highly discouraged unless the Dean provides permission. In global protocols, it is extremely important to also follow the guidelines and laws of the country in which the research is being done. So in addition to following US, GW, DC rules and regulations, the research reopening has to be conscious of things that are being done in the host country or the country of the research, as my global health colleagues well know. Our fourth working group was on lab-based research. And in this case, we actually had 2 different components. Mimi Ghosh coordinated the one for Science and Engineering Hall, where many of our lab PIs work. And I want to thank them for their cooperation. And I'm also very happy that Kyle Levers from Exercise and Nutrition also worked with his colleagues to develop one for the lab that is in the basement of the 950 building, the Metabolism and Exercise Testing Laboratories. These are great guidelines for those of you interested, and includes an introduction for some general concepts and ideas around labs that we were able to develop in our office as well. And the fifth working group is on what we call virtual or digital research, research that is actually done. As you know, mHealth, eHealth, ICT, all those types of instruments that many of us use. In this guideline, we've also highlighted issues pertaining to the infrastructure. And I'm actually trying to see if those researchers who use things like intensive technology resources or high performance computing and those types of resources are able to meet with the new Director of Research Technology Services at GW as well. I look forward to trying to coordinate that meeting in the next couple of weeks. But here, these guidelines provide some support as you go through the phases for your research. So section 4 is a collation of those 5 or 6 working groups and their current drafts. I want to pay, again, not only my thanks to all the people who participated, but also alert you that the section 5, which is the last section of the document, is really important. This is what we call the approval process for research reopening. And in accordance with guidelines from GW and OVPR, we've created a process for approving the reopening and restarting of any research study or lab that was shut down or ramped down. This section will outline, it's a brief section, and it has very clear instructions about the types of information that is needed to be submitted to us. We've identified 9 sort of domains of information that we would like. These 9 domains of information cover things like who's the PI and what the project is on and what space is needed and what the status of the IRB on, but also things like what types of PPEs or responsibilities are pertaining to different individuals. And just in case things go wrong, as they are in many, many states around this country, and we go from opening up to actually beginning to ramp down things, how will the project respond to those situations? At least some thinking on that. We want to make sure that people are conscious of the fact that there is a possibility, unfortunately, if things don't work out, that the cases of COVID and God forbid, the hospitalizations and deaths may move in the wrong direction. We've actually now developed a Word document that we hope will be easy for PIs to fill in. And again, that will be put on the website by the end of today. Very happy to also get feedback on that. But the process that we currently have is that the PIs get approval from the chairs. I believe that the chairs must know which research projects and studies are being picked up. I think it's incredibly important for a chair to be aware of all of the studies and all of the PIs that are working in his or her department. And then it comes to my office for my approval, and I'm going to work very closely with Dean Kazim, depending on the operations or logistics implications of that study. We hope to do this in a very quick way. We do not want anybody to wait. And for those individuals who have, let's just say, any special needs, like a donor is waiting and needs to be informed of something, or funding is running out in the next 30 days. If you have very special circumstances, then please alert us. And we will work very hard to try and accommodate those circumstances as well. Notwithstanding that, including myself, we believe that all of our projects are of vital importance and should be done immediately. Notwithstanding that respect, I think it's incredibly important. Now, in fact, as we were thinking about this, what happened is that the Office of Human Research here at GW, actually, we were thinking of this independently, but suddenly we were told that this approval process will actually be required by OVPR and the Office of Human Subject Research. So I'm going to make a quick segue for now. So I've described to you these 5 sections: the introduction, the OVPR section, the section introducing the school general guidelines that Dean Kazim is working on, the collation of the 5 working groups in section 4, and then the approval process. And this document will be on the website by the end of today for all of you to download, see, comment, reflect, or use as best needed. I want everybody to understand that this is a living document. If things change, if the virus changes, the nature of the impact changes, we will go back to it and address it as soon as possible. But what I want to spend a couple of minutes on is that while we were thinking, we were actually informed, not necessarily early in the process, but really an hour before an email went out last Friday, that the Office of Human Research, which actually is the office of the IRB, for those of you who may not heard that term, the IRB, the Institutional Review Board of the Ethics Committee of GW, is in the Office of Human Research, that actually they have been working on submissions to the IRB for people who are reopening, restarting their labs and their research studies. And what they want is actually school approval before PIs go back to the IRB. So, for example, you were doing a study interviewing people, and then you stopped that because of COVID. Now you want to start the study again. So you would need to go back to the IRB and inform that human subjects interaction is starting, and there is a promptly reportable information form, which is basically a form that you have to fill in informing them that you're resuming research. Well, in addition to that form, they want, in the case of School of Public Health, school approval; in the case of other schools, departmental approval. And this is true both for existing studies as well as if there are new studies that weren't going on before COVID, but are starting now because of a new research grant or a new project. So we weren't actually aware of that, but it so happened that we were preparing this. And when they informed us on Friday that this is going to be a requirement, I was really happy that we had been thinking about this. The other thing that they've done is which is very nice, is they have a 3 or 4 page information sheet / consent addendum. What this means is that now you don't have to develop your own material for telling your human subjects about COVID. They've already developed it, they've stamped it with the GW IRB, and you can download and use it. So it's posted on their website. I'm happy for Michael or somebody to actually put the link of this addendum in the chat board in a minute. It does not need IRB approval at all. You can use this addendum with your approved consent forms. And obviously, if you are already going back for some change in consent or to get new approvals, you can be rest assured that this addendum can be part of the process of human subject interaction. So I think this is a really good move by the IRB, because a lot of us will be looking for general information sheets, and now we can use the one that is developed by the IRB. So here's the website. I just wanted to make Of course, there, as I indicated to them, that there may be many PIs who may have questions. They have assured me that they will try and respond to emails, phone calls, and be available for consultation. However, I do want to remind everybody that we, my office, the Office of Research, also has individuals who are on. Dr. Paul Ndebele sits on the GWIRB, is available for consultations if you want a quick consult, or if you want to discuss any particular amendments or issues with him. He's also available today on the e-hall if there are specific questions. So thank you very much for your attention. Once again, my attempt is to throw open the conversation, to give you an overview of what we've been doing between June 8th and now, since we got word from OVPR, and obviously very, very happy to engage in a discussion and try and respond to as many questions as possible. Before I throw the floor open, I do want to provide Dean Kazim a minute to provide any update on the general reopening guidelines of the school. So Natasha, if you want to give us a quick update on that, and then I'll throw the floor open.
Thank you, Adnan. I appreciate that. I just wanted to let the research community know that there was an info mail that had gone out related to a phased reopening that is going to commence as of July 6th. I just want to be very clear that this reopening is only meant to provide guidance from the time from July 6th through the end of August. It is not meant to provide guidance for the fall semester, which is currently still underway. The operations and administrative team of the Dean's Office is working alongside of the central offices in order to evaluate all of the needs that our community is going to have as we begin to reopen campus. But during this period of time for the summer month, we are looking at opening at 25% capacity across the university. Now, how we are translating that here at the School of Public Health is we are going to continue business as usual. That indicates that all remote work is going to continue to take place until further notice. So nothing is going to change in that regard. As far as determining whether or not, as Adnan stated, research operations are going to open based on investigator, Adnan and his team has provided the tool that will be used to evaluate these requests. I will be working very closely with him on evaluating the needs, the operational needs that come with those. So I encourage you to please work through the Office of Research if you are looking to reopen your lab based on the criteria that has been established during this period of time. Also, please note that going forward, any return to campus is going to require a dean or a vice president approval. So if you are looking to return back to campus during this time where we are looking at a phased opening, this will need to be submitted via the Office of Research, and we will have to obtain the deed signature in order to be able to approve those requests. The individuals that have already been deemed essential by the process that Adnan and I have been overseeing during this time of virtual learning can continue their normal operating procedures. There's nothing that is required of you to provide us at this time. Additionally, we are also going to be working very closely with your department heads so that they are aware of the decisions that we are making collectively and are in tune to how that is going to kind of impact our campus footprint going forward. And I just want to reiterate as well, for all of the members of our community, if there is any sign of illness for yourself or members of your team, please, please, please stay home. This is going to be a new social behavioral norm that we are all going to have to practice in order to secure the safety of our community. So I encourage you to support and work alongside of the leadership here and really trying to get this message out to our community that at any sign of illness, we do not want anybody coming onto campus. The guidance that Adnan referred to, which is the broad guidance that we're going to be operating in terms of the operational guidelines, will be available within the next few weeks. We are still going through the process of getting the appropriate information from the university committee about reopening and integrating that to be much more School of Public Health specific. So we will be sure to send out a communication that directs our community to the appropriate directions at the time.
Thank you very much, Natasha. Really, really good to hear that. And I just want to, before I turn to Ami's questions, I'm going to recap a couple of things. One is what I hear from you is that everybody continues remote operations unless that individual has been approved by the dean's office to come in. So that's the first thing I hear loud and clear. And the second one is if you were already approved as an essential personnel based on the previous process, you may continue as is. And so I think those are important guidelines. Thank you very much, Ami, for opening the discussion board. I think, let me try and get through. So first, in terms of the approval process, I know that there are one or two of you who had a sense of urgency, and I'm working with you separately. I don't want the one or two of you who I'm already engaging with to worry about the sequencing, but I'm going to answer Ami's question starting today. The sequencing would be that you would fill in the requisite Word form for research reopening with the 9 domains of information, and a PI will submit that to their chair. Once the chair says, okay, this looks good to me, please submit that to my office. So yes, it will go to the chair first. I do not like to see things that chairs are not aware of or our chairs are not familiar with or haven't approved. I think that sequencing is ideal. Now, regarding IRB, knowing the nature of the IRB, knowing the nature of the urgency of research, knowing the nature of how things sometimes don't work very well if you put them in a sequence, my recommendation is that you start the process at the same time. In other words, if you have to go to IRB as well and you know that, please start work with them while you've also started work with us. At some point, they're going to call us and say, do you approve this? Does this person have an approval? Or they're going to ask you for an approval letter. Hopefully by that time, you would have seen yours. So Ami, I would recommend that you don't wait for one to be over the other unless that's needed. As I said, at some point, they will be asking PIs for letters. In that instance, obviously, we will try and ensure that you have that letter of approval from us. In terms of the labs, thank you for raising the question, Ami. For those of you who don't know, Greg Davis was our lab manager. Extremely great contribution over the years. We had a meeting of all the lab PIs in SEH yesterday. Every single one of them had fantastic words to talk about the role that Greg played in establishing actually the labs and in promoting the work. So I want to acknowledge his contributions and in absentia, thank him for those of you who may be his friends and so on. But we were aware of that as of last week, and Natasha's team has moved very quickly to maintain continuity of operations. And the new point of contact for all lab operations in SEH is going to be Bahare. Maybe I'll ask Natasha to comment on this as well for a minute. Natasha, would you like to come in?
Yes, absolutely. Thank you, Adnan. So in terms of the interim transition that we are going to have, sadly with Greg's departure, we are going to have 2 established points of contact. The first point of contact for all of our investigators regarding anything within public health labs is going to be Bahare Sarami. Bahare is very much a known entity within public health, as when she first joined us, she was detailed to the support of the lab and is very familiar with all of our investigators, their labs, and their needs. In addition to supporting Bahare, we are going to have John Toomey, who serves as the Director of Facilities and Operations here on campus. John brings a wealth of knowledge in terms of lab facilities management and support. He has built BSL-3s in his former life prior to being here at GW. So we are in very good hands in the interim, which I'm very thankful for. We are going to be continuing to evaluate the needs of the lab, the support that is required to all of our investigators, with an emphasis on bringing forward a high degree of service. And as a part of this context that we're all operating in within the university right now, where we are in a hiring freeze, we are really going to be very thoughtful for the duration of the summer and really figuring out what the best support is going to be. And we are going to look to the research community, especially our lab investigators, to provide us with some information on that, their feedback as well, so that we can make the best informed decisions possible. If at any time between Bahare, John, and even myself, I want you to please feel free to reach out to me if there are needs or issues that need to be addressed. And we'll be sure that we continue to be able to support our investigators as we continue to look at this phased reopening going forward.
Thank you very much, Natasha. And I really want to, again, thank your team, especially Bahare and John as well, to supporting our return of our research operations. And so for anyone with any questions related to SEH, your first point of contact can be Bahare, and she will be sure to delegate that or move it up or down the chain, whatever the case might be. So thank you, Ami, for those questions. I thought those were really important. And I hope that Michael is posting links both to the IRB and to the forums as well. And again, I also learned that the IRB sends these emails out, but it turns out that many PIs don't actually receive those emails. And we learned that because actually I wasn't receiving emails until end of last year. And then I realized that people were talking about these emails from the IRB, but I wasn't actually aware of them. And so I was able to contact the IRB and rectify that. But I think that may be true for many PIs. And so we did put the links out this morning in our Wednesday newsletter for those of you who received the Wednesday newsletter from the Office of Research. And if not, we'll also put it up on our website. And we have a landing page now on research and COVID-19, and all things pertaining to this issue will be there, thanks to many of my own colleagues. I do want to turn to some of these other sort of issues, and sorry, just want to reiterate and thank Bahare as well for putting up, maintaining our continuity of operations. Yes, so Sarah, thank you very much for your question. I think it is extremely important to understand that as long as GWSPH is involved in a research study, you or whoever is the PI, I think it is extremely important that we are informed that a particular research study with our principal investigators is restarting. And this applies to all global research as well, and would be important. I know many countries are reopening and things at different rates. I was on a call with a colleague from Uganda, and they've actually gone into the field, even though parts of Uganda are still shut down. So I raised some red flags there, not sure whether you should get into field operations, but let me know if I'm understanding your question correctly, Sarah, but do you want to let me know if you want to come in and specify anything further?
No, that's great, Adnan. Thank you. I appreciate it. I want to kind of make sure that I'm following GW procedures while our partners in country, are moving to also move from online to in-person. So it sounds like just getting in touch with the chair and then going through this structure is the way to make sure everyone's informed.
Yes, we, obviously I'm on both sides of the equation, right? So as a researcher, I also have to restart my research, so to speak. So I want to have a balance between the need of the PI to move quickly and be nimble and make sure that our donors and our collaborators are well informed and we are responsive, to the other side, which is what is our institutional responsibility of making sure that our researcher, faculty and staff are well prepared, well informed, and what support do we need to provide them. So I hope that this forum, and if any of you have further feedback on the forum, feel free, please, to reach out to us. As I mentioned, that these are not written in stone, so to speak. They are, we are very happy to get feedback. So folks, if you have questions, you have any comments, you have reflections, even anything else that you'd like to raise today. I noticed that there are, close to 35, 40 people here, which is really, really remarkable given the short time frame we gave you for this webinar. So I truly appreciate your time. If there is anyone who would like to speak or discuss anything else, I'd be happy to give them the floor, or if you want to put something in the chat board. I actually can't see every name, but if there are any other chairs or any other individuals who would like to reflect on anything, I'd be happy to give them the floor. I'm just going to wait for a second here to make sure. Lauren, let me know if you can see better, if anybody's raising their hand or would like to come in. Again, if we don't have, I think there isn't a better meeting than one that ends early and gives us back a little bit of time. But let me make sure first, my own team. So colleagues in the research office, is there any other point that we should raise before we end up? Any one of my colleagues would like to come in on any particular point or to clarify anything? If not, could I ask Natasha, you to reflect on anything else that you feel might be important?
Yes, thank you, Adnan, and thank you for bringing us together as we try to navigate these very uncertain times as a community together. I just wanted to share that during these unprecedented times of stress, our staff as well as our faculty do have unique needs, whether that is as a result of their own personal health circumstances or those that they care for. I've been working very closely with a number of members here towards getting accommodations in place, especially those pertaining towards mental health, which is an area that we still have a tremendous amount of work to do. So if you are aware of anybody on your team or a colleague that needs support in this regard in order to be able to be positioned to be supported to do their best work, please contact me, please contact the HR team. We will work very closely with the EEO office, as well as that person's clinician, to be able to determine some of the things that we can do by way of accommodation to help ameliorate some of the burden that is being placed on people as way of stress during this time. Thank you, Adnan.
Thanks very much, Natasha. And again, thank you for taking the time to join us as well. A couple of things before we end. First, I do want to check with Paul. Paul, any other perspectives on the IRB ethics side, please, before we move on?
Thank you, Adnan. Just to emphasize that even after restarting our project activities, we need to keep our projects under review with regards to the COVID situation, checking also on the measures that would have put into place so that we can always try and improve on those measures. So this might actually mean that we might have to cut down again or even stop our project activities. So I'm available for consultations anytime via email or by calling. Thank you.
Yeah, thank you, Paul. Thank you. And like I've said before, Paul's available for consultation and advice. Really appreciate the guidance that you can provide. So folks, I don't see any new comments on the chat board. I don't see any other hand or going up. I know that some of you have joined a little bit late, but this webinar is being recorded. So we will make sure that it's on our website for those who've missed it. I will make sure that the PowerPoints are available also. And Michael, before the end of today, will have the collated draft guidelines, the approval process document, and any other helpful things that we have. We'll also have links to the IRB and the OHR website on this special page that we've put together. Thanks to, again, my colleagues. Before we end, I always like to acknowledge the difficult times that we are living in. I hope that all of you are, and to build off on what Natasha was saying, that we have been hit very hard with the COVID-19 pandemic. But it is also true that many of us, I think actually all of us, in some way, shape or form, have been hit hard by the other pandemic of racial injustice and inequities within the country, within our communities, within the larger public health system as well. I think it is incredibly important for us to recognize that it is not just something out there, but it's also something in here. I have actually raised this topic of looking at how we do research across GW. How can we do it in a more inclusive manner? How can we fight racism in research? And we'll be discussing this at the different fora that at least I participate in. I welcome your thoughts and your reflections on that. I hope that you will remain strong during this time in many different ways. Each of you do incredible work. Each of you is vital to our research enterprise and to our school. So I want you to know that. I want to thank you for the contributions you make to our community. Please continue the good work, but look after yourself and your colleagues as well. Thank you for joining us today. Thank you to Natasha's team and my own team for hosting this. We will keep this conversation going, and in a couple of weeks, have another opportunity. Take care, folks. Thank you very much for joining us. Bye-bye.